Hey future DAs, it's your DANB Study bestie Leela. Who else? Welcome back to
The DA Study Spot, yeah.
Let me ask you something right quick. After a procedure, exactly what happens to those instruments? Because if you think we're just rinsing them off and putting them back, bestie, there's a whole 7-step process that the DANB is going to test you on. And that's exactly why we're breaking down Chapter 21 today, straight from the MDA 15 edition textbook. Principles and techniques of instrument processing and sterilization. This information right here is high yield for your ICE components, so grab your notes and let's get started. But before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! So the first thing you need to know is that instrument processing is a 7-step process. The book lays this out and you need to know it in order. Let's go through the steps.
Step 1 is to transport. You move contaminated instruments to the processing area in a way that minimizes exposure risk. Use appropriate PPE and a rigid leak-proof container. Step 2, cleaning. Clean instruments using a hands-free mechanical process like an ultrasonic cleaner or instrument washer. If instruments cannot be cleaned immediately, place them in a holding solution. Step 3, packaging. Wrap or package instruments in appropriate materials before sterilization. Place a chemical indicator inside the package. If the indicator is not visible from outside, also place an external process indicator on the package. Step 4, sterilization. Load the sterilizer according to the manufacturer's instructions. Label packages, do not overload, and place packages on their edges in single layers or on the racks to increase circulation of the sterilizing agent. Step 5, storage. Store in a clean, dry environment in a manner that maintains the integrity of the package. You want to rotate packages so that those with the oldest sterilization dates are used first. Step 6, delivery. Deliver packages to the point of use in a manner that maintains sterility. Open packages aseptically. The best practice is to open the package after you have seated your patient just before the procedure starts. And last step, step 7, quality. An effective quality assurance program should incorporate training, record keeping, maintenance, and the use of biologic indicators.
Before you can process an instrument, you need to know what category it falls into, because the category determines the minimum level of processing required. And the book uses 3 classifications.
First category, critical instruments. These are instruments that penetrate soft tissue or bone. They're the highest risk for disease transmission and must be sterilized. Examples are forceps, scalpels, bone chisels, scalers, and burrs. Second category is semicritical instruments. These are instruments that contact mucous membranes but do not penetrate soft tissue or bone. These are moderate risk and should be sterilized, especially if they are heat tolerant. They should be heat sterilized. Examples are mouth mirrors, amalgam condensers, or like bite blocks. The book states a fundamental rule. If an item can be heat sterilized, it should in fact be heat sterilized. Last category is non-critical instruments. These are instruments that contact only intact skin. They're very low to no risk and require immediate to low-level disinfection or basic cleaning. Examples of these would be external, dental, x-ray head, position indicated device, lead apron, and curing light. Again, something else I touched on in our previous infection control study session, so you can go back and check that out if you haven't already.
The instrument processing area, also called the sterilization area, should be centrally located in the office to allow easy access from all patient care areas. That way the workflow will always move in one direction. Dirty to clean to sterile to storage. Never doubling back.
The 4 zones in the processing area are receiving, cleaning and decontamination, preparation and packaging, sterilization, storage. Items are to move through in that order every single time. Basically, cleaning and decontamination should never happen in the storage area. PPE is also required in the processing area. You're going to use utility gloves, not examination gloves, your mask, eyewear, and protective clothing always.
There are 2 methods of pre-cleaning instruments.
The ultrasonic cleaner, which uses sound waves to produce cavitation. So this is tiny imploding bubbles that loosen and removes debris from instruments without hand scrubbing. This is to reduce the risk of a dental assistant getting cuts or punctures. Also, the ultrasonic cleaner must be kept covered during use to reduce spatter and contaminated aerosols. And at the end of each day, you must discard the solution. Again, PPE must be worn the entire time. The second method is thermal dental disinfectors. These are automated washer disinfectors that use very hot water recirculation and detergents to remove organic material. The FDA must approve them for use with dental instruments. Instruments processed in these units must still be wrapped and sterilized before patient use.
Important, clean instruments are not sterile and can harbor pathogens. This is why instruments must be packed and sterilized before they are used for patient care. Now for the big one, sterilization methods. The book not only covers these, but it gives advantages and disadvantages side by side.
So for the steam autoclave, this uses moist heat under pressure. It's the most common and has 4 cycles: heat up, sterilizing, depressurization, drying. It is the heat, not the pressure, that kills the microorganisms. The advantage, short time. Disadvantage, it damages some plastic and rubber items and it requires distilled water. Typical temperatures are 250 degrees Fahrenheit for 15 to 30 minutes or 273 degrees Fahrenheit for 3 to 10 minutes depending on the cycle. Then there's flash sterilization, which typically happens in an office that is very busy with multiple providers. This is rapid steam sterilization for unpackaged instruments and handpieces in short exposure time, used only for instruments needed immediately. For example, the schedule is full, you just use your last clean restorative pack and your next crown patient walks in. But of course, the best method is sterilization where instruments can be packaged before use. Next, we have dry heat static air. This works like an oven. Heat rises through natural convection and takes 1 to 2 hours. The advantage, no corrosion. The disadvantage, it is time consuming and it may not be effective if operator error occurs in timing. This operates between 320 to 375 degrees Fahrenheit. Next is the dry heat forced air, also called rapid heat transfer sterilizer. This circulates hot air at a high velocity, reducing time needed. Exposure time ranges from 6 minutes for unpackaged to 12 minutes for packaged items after sterilization temperature is reached. And the last sterilization method, liquid chemical sterilants. These are for the instruments that cannot withstand heat. For example, dental dam frames, shade guides, and X-ray film holding devices. And 2% to 3.4% of glutathione must be used. It does require a 10-hour contact time, so don't think you can just flash sterilize these, because anything shorter is disinfection, not sterilization, and we know those two are not the same. Now, instruments must be rinsed with sterile water after removal, handled with sterile gloves, and delivered to point of use in an aseptic manner. But also keep in mind that sterilization cannot be verified with biologic indicators, so make sure you're going to that 10-hour mark. You can even go 12 or do it overnight.
Now pay close attention because this is where students lose points on the DANB. There are 3 forms and you need to know all 3.
First form is physical monitoring, looking at the gauges and recording temperature, pressure, and exposure time on a sterilizer. Correct readings do not guarantee sterilization, but an incorrect reading is your first signal of a problem. Remember, the temperature recorded is for the chamber, not the inside of the pack. The second is chemical monitoring. It uses heat-sensitive chemicals that change color when exposed to certain conditions, and there are 2 types. Process indicators that are external. They are placed outside the package. They are also known as single parameter indicators. They identify that packs have been exposed to a certain temperature only. They do not measure duration or pressure. The other, process integrators, which are internal, they are placed inside the package, and they are also known as multi-parameter indicators. They respond to a combination of heat, temperature, and time, and they are more reliable.
Keep in mind that chemical indicators do not indicate sterility, and they're not a replacement for biologic monitoring.
Biologic monitoring, also called spore testing, this is the only way to determine whether sterilization has actually occurred and confirm that all bacteria and endospores have been killed. The CDC, the ADA, and the Association for Dental Safety all recommend at least weekly biologic monitoring of sterilization equipment. Please note that a positive result means sterilization did not occur, while a negative result confirms sterilization did occur.
All right, besties, that's the end of Chapter 21, Instrument Processing and Sterilization. 7 steps, 4 sterilization methods, 3 instrument classifications, 3 types of sterilization monitoring, and a partridge in a pear tree. This is ice gold. Don't say I never give you anything. Now, one of the best ways to practice for an exam is to use exam style questions, which I have linked in my description box. You can get the ultimate study guide that has 375 plus questions with answers and rationales for all 3 exams, or you can get the mock exams and flashcards. Either way, you're going to walk into your exam feeling confident and knowing exactly what to expect. Click that link in my description box and check out all the study materials. Do you have an exam date coming up? Drop it in the comments and tell me, what are you most nervous about? And if you found this video helpful, like, save, subscribe, and share with a DA bestie, and I will see you both at the next study session. Bye!
The DA Study Spot, yeah.